Doctors are warning about an impending penicillin shortage. Pfizer has informed the FDA that all of its versions of the powerful antibiotic will run out within the next few months. Meantime, the pediatric or children's version of the drug could be completely out of stock within the next couple of weeks. Pfizer says it may not be able to replenish supplies until next year. Let's bring in Dr. Bob Lahita to break this all down for us. He works at the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. He also wrote the book Immunity Strong. Dr. Bob, so remind our viewers what penicillin is used for and what people are potentially at risk for because of a shortage.
Well, Vlad, penicillin is a widely used drug for a lot of stuff. And from October of last year, 2022, we've had shortages of amoxicillin, the liquid form, which is used in children. It's used for strep throat. It's used for all sorts of urinary tract infections, upper respiratory infections, and most importantly, for the injectables, which are really in short supply in the hospitals, for syphilis. And believe it or not, we're at a 70-year high for syphilis infections. And why is that? Not because there's more syphilis, but likely that during the pandemic, nobody was very much looking at syphilis cases. So screenings went down. And now all of a sudden there's this massive surge for treatment with a drug called benzathine penicillin G. That's injectable, mostly in emergency rooms, clinics, and hospitals. But it's just not available anymore, and it won't be until next year.
So is the reason for the shortage the spike in syphilis and other things? Is that the primary reason?
No, that's not the primary reason. It's supply problems. It's the fact that the companies that make the components are overseas, and also that some of these companies are moving their plants overseas. So those three things, plus the post-pandemic surge in infections, makes it very, very difficult to keep supplies up. So that's why Pfizer said, these long-acting penicillins are not going to be available to hospitals, clinics, and emergency rooms. The patient, the average person who goes to the pharmacy to get penicillin with a prescription is not going to get the injectable form. The injectable form is a problem for us in emergency rooms, hospitals, and clinics. But what is in shortage, if your child has strep throat or a sore throat or an upper respiratory infection and needs penicillin, amoxicillin, that's not going to be available. So other antibiotics have to be used instead.
So should people be worried?
No, people should not be worried. These kinds of shortages occur periodically. Here's what we do in such a case. We give you a substitute or an alternative antibiotic. Every doctor, when a patient has an infection, take your 10-year-old who has a sore throat. We swab the throat, we look for streptococcus, and if the patient or the child has a strep throat, we treat the child normally with injectable penicillin or with amoxicillin going forward as an outpatient. When that doesn't exist, we will use a substitute antibiotic. The only thing is the cost is different, and also the side effects can be different for these substitute antibiotics.
We've actually been hearing about a number of different shortages when it comes to medication, whether it's cancer drugs, I think was the most recent thing, Adderall shortages. And some of it has to do with, heightened demand because some people are using it for other reasons, not necessarily the reasons those drugs were created. But, what is going on? Is it, is it a combination of demand and what you talked about, sort of pandemic related issues?
Well, we can use examples of that, Anne-Marie. Look at the the hydroxychloroquine shortage during the pandemic. Remember, the president of the United States at that time suggested that hydroxychloroquine, better known as Plaquenil, could be used to prevent COVID. We ran out. The arthritis patients, the lupus patients couldn't get it if they bribed the pharmacist. It was just not available. The same thing with ADHD or attention deficit disorder with Adderall. It's just not available. So other drugs have to be used in place. And there are also cancer drugs that are in short supply. And this happens periodically. And again, it's because of increased demand. It's because of the surge. A lot of it post-pandemic, which is unfortunate, but it's what happens.
All right. Dr. Bob Lahita, thank you.
Thank you.